Hi everyone, my name is Micah Joslow, and on behalf of the Kansas Recovery Office, I'm really excited to be here with you all today to be talking about two really exciting programs that are going to hopefully bring a lot of money into the state of Kansas to support our medical providers across the state. I myself am a consultant at Boston Consulting Group out of the Los Angeles office, and I'm really excited to be partnering here today with Jen from our partners at Witt O'Brien's, as well as a number of different state agencies today to bring you all this webinar. I'm going to share my screen really briefly. I know that we have a number of individuals still joining, but I want to make sure that we honor all of your time and make sure that we have plenty of time for questions and answers at the end of today's session. As I said, the goal for today is to discuss several different federal healthcare reimbursement programs that are going to be open to providers across the US, and particularly here in the state of Kansas. Over the course of today's webinar, we're going to be focused on three big things. First, we're going to start by describing the upcoming federal provider reimbursement opportunities. Next, we're going to define some clear action items for next steps to prepare to apply for federal funding as these application options start to become available. And finally, we're going to clarify additional support available through the Recovery Office within the state of Kansas to help make this application process as seamless as possible. Before we dive into content, we have a number of different co-hosts here with us today that I'm really excited to have the opportunity to introduce. Our co-hosts come from a number of different organizations, but all have a very strong background in the medical space. And as a result, we'll hopefully be able to answer all of your questions and concerns about this individual program. We're going to start off with Marcy Nielsen, who is the Chief Advisor for COVID-19 to the state of Kansas, who's going to kick us off with some introductory remarks.
What about now? There we go. Can you hear me? Are we good? Okay, terrific. Well, thank you everyone for joining us this afternoon. I appreciate the opportunity to kick off this important topic. I have been working in health policy my entire 30+ year career, and we've seen the world of telehealth open up during this pandemic in ways that are likely to change medicine forever and potentially in some really positive ways. The data tell us that patients really appreciate telehealth and very much like telehealth. We have been able to smooth out some of the rough patches in the delivery of telehealth services. But from a provider perspective, the reimbursement piece is critically important. And we have been pushing for payment parity around telehealth outside of the pandemic public health emergency window. So this opportunity from the federal government creates a really important process for us to ensure that providers are getting paid for these services. And so the opportunities here are fantastic. There are some minor, we hope, bureaucratic hurdles to jump through. And so again, just want to underscore this tremendous opportunity and remind providers that this isn't the same thing as payment parity, but it is a way in which to get paid for services that are so important to patients in Kansas.
Thank you so much, Marcy. And we're really excited to also be joined by representatives from KDADS and KDHE, Andy Brown, Ryan Lester, and Joan Dude. I know that it looks like Andy has not yet joined us, but Ryan, would you like to kick us off?
Of course. I just wanted to start out by thanking you all for joining the telehealth webinar today. I am so incredibly excited for you to hear about these federal programs to help support and grow telehealth in your practice. Telehealth, as you know, is a powerful tool in chronic disease prevention and management, which is more my specialty. Telehealth interventions can improve clinical outcomes by increasing medication adherence, setting dietary goals for patients, provide a more complete data picture for clinicians, and reduce access to care barriers for patients, especially in rural and underserved areas. If matched with the right preventive supports and episodic services, we know that telehealth can be a real game changer for both patients and practices alike. That one real world example that I always think of is that Kansan, that's the low wage earner that has all kinds of barriers to care, like having to take off unpaid time from work, and having no access to transportation. People that really experience some of these hardships that make coming into a clinic very difficult. So then they often make tough choices to delay their care for chronic conditions. So we know that one way to get around those barriers is telehealth. And of course, we know that that will come with challenges, but in the short and long term, integrating telehealth will help mitigate and eliminate many of those access to care barriers for Kansans. And so we see increasing telehealth as a real win-win scenario for patients and physicians alike.
Thank you so much, Ryan. Really appreciate your remarks. Joan, would you like to speak as well?
Oh, there we go. Thank you all for joining us today. As perhaps the newest member of the KDHE team, here to help with COVID response. I am a family practice physician with a master's degree in public health. And I'm really, really excited about this opportunity for practicing providers here in the state of Kansas. So I'm going to give you a little cheerleading speech here. Hippocrates said that health is the greatest of human blessings. And, we all know that there are many things that contribute to overall health, like our genetic makeup, our physical environment, but access to affordable and appropriate healthcare is also really critical to preventing sickness and achieving healthy outcomes. So what I've learned about Kansas is that about 80% of Kansas counties are designated as health provider shortage areas or medically underserved areas. And many of those counties, when you look at county health rankings, are home to the unhealthiest Kansans, with higher rates of obesity and tobacco use, low birth weight infants, preventable hospitalizations, and lower rates of immunization. So not surprisingly, people living in these counties report more days of poor physical and mental health and have the highest number of years of potential life lost. So accessible and appropriate healthcare in rural and underserved communities is one of the essential public health tools that we need to tip the balance toward individual wellness and social and economic vitality. Access to telehealth services can help reduce inequities in care for underserved communities by providing access to services for patients regardless of where they are located. That reduces the need to travel long distances to access care, especially those seeking specialty services, and it eliminates travel for those who have mobility or transportation difficulties. Interestingly, nationally, state public health WIC programs saw significant increases in clients registered, most of them from underserved communities, and services that they provided as a result of COVID-related changes that permitted telenutrition visits in WIC. In addition, the convenience of care, increased access, improved worker productivity because people don't really have to take time off and travel to appointments, decreased costs, and time savings for clinicians also offer benefits to all of us wherever we live. A physician named Dr. Resnick said the rapid and widespread adoption of telehealth by physicians in 2020 was one of the most significant improvements in healthcare delivery in decades. The successful adoption of telehealth throughout the country has demonstrated that if the financial barriers are removed, we physicians will adopt these important innovations in the delivery of care that are necessary to improve our patients' health. So in closing, there is a Victorian philosopher, Thomas Carlyle, who said, "He who has health has hope, and he who has hope has everything." So I'd like to thank you for your interest in this opportunity, and I look forward to the important and hope-giving applications and innovations you will bring to telehealth to increase access to healthcare for all Kansans. So thank you.
Thank you so much for your inspiring words today, Joan. And finally, I want to hand it over to Andy Brown from KDADS, who's their Commissioner of Behavioral Health Services, before eventually handing it over to Jen Gurian for the content portion of today's webinar.
Yeah, and my name is Andy Brown, the Commissioner for Behavioral Health Services at KDADS, and I want to say, like, this is both of these programs are actually very important to both telehealth and access to services for people with severe mental illness, and also SUD and problem gambling type disorders. We really see both of these as being programs that offer our provider network opportunities for sustainability and for expanded service delivery during the public health emergency. And so we really do encourage any of the providers in our network to apply for these funds and pursue using those to help with continuing to provide quality services to Kansans around the state.
Thank you so much, Andy, for your words and for being here with us today. So I'm now going to pass it off to Jen Gurian, who is a medical doctor, but also a consultant at Witt O'Brien's, who's going to walk us through the content portion of today's session before finally hearing from Monica Simpson, who is the public relations specialist at Labette Center for Mental Health Services, here in Kansas, to talk about her experience with the first round of FCC telehealth funds, as well as the Provider Relief Fund. So Jen, I'm going to pass it over to you to introduce yourself.
Thank you, Micah. As Micah said, my name is Jen, and I am working with Witt O'Brien's as a consultant. I have a lot of experience in grant-related work, especially in rural areas, and I'm really excited to talk to you about the opportunities. So if we could go to the next slide. Okay, so the two programs we'll be talking about today are the COVID-19 telehealth program and the Provider Relief Fund. The COVID-19 telehealth program is to help providers cover costs associated with delivering connected care services to patients. The Provider Relief Fund is to support providers with the financial strain of the COVID-19 pandemic. You can go to the next slide. So both of the COVID-19 telehealth program and Provider Relief Fund will be available to most medical providers in Kansas. Some of the eligible categories are hospitals, which include community health centers, local health departments, health centers providing healthcare to migrants, medical schools, which include post-secondary educational institutions offering healthcare instruction and teaching hospitals, behavioral health service providers, community mental health services, and skilled nursing facilities. You can go to the next slide. Yeah. The FCC was allocated additional $250 million in funding for telehealth, and the goal of the program is to help healthcare providers to provide connected care services to patients in their homes or at mobile locations in response to the COVID-19 pandemic. The program fully funds providers' telecommunication services, information services, and devices necessary to provide critical connected care services. The next slide. So we're going to go over two different aspects of the FCC COVID telehealth program. It could be used for in a variety of ways, which includes synchronous versus asynchronous services. So on the provider facing end, usually the eligible costs are for telehealth provider licenses, public Wi-Fi, bandwidth upgrades, video conferencing equipment, which include webcam, laptops and PCs, and telehealth carts. On the patient side, there's patient Wi-Fi or hotspots, Cell phones that have mobile device management systems, which is something that limits patients to using their cell phones for telehealth purposes. Remote monitoring devices, which include Bluetooth-enabled glucometers, blood pressure cuffs, thermometers, pulse oxes, and other digitally connected devices. Another use would be a patient engagement platform, which helps providers with patients with digital check-ins, digital intake, consent, helping providers with placement services. This also helps with things like pre-admission and other kinds of communication. Another eligible use for these funds would be remote patient monitoring, which is a method of healthcare delivery that is used to gather patient data outside of the traditional healthcare setting. So you can go to the next slide. So in terms of preparing for this opportunity, there are a few steps that as providers we can take to make sure that we're ready. So those three things for the FCC telehealth program are to obtain eligibility determination from USAC. And this is basically filling out a form with the FCC, and then obtaining an FCC registration number, which includes setting up an account with CORS with username and password. And then once you set up in CORS, you can register for a new FRN. And then registering with SAM, which is providers must register with the federal systems for award management to receive COVID-19 telehealth program funding. A lot of you may probably already have these steps in order if you've applied for other programs, and some of you may need to renew if it's been some time. So that's one thing to consider as we're waiting for the application for this to launch. Go to the next slide. So for the Provider Relief Fund, through HR 133, the Department of Health and Human Services was allocated an additional $3 billion to be distributed through the Provider Relief Fund. Qualified providers of healthcare services and support may receive PRF payments for healthcare related expenses or lost revenue due to COVID-19. These distributions do not need to be repaid to the US government, assuming providers report on use of funds for healthcare related expenses or lost revenue. Disbursed funds do not need to be applied to treating COVID and can be applied for by medical providers that do not treat COVID. Funds do not need to be applied in a specific timeline either. The HR 133 eased the PRF definition of lost revenue and allowed parent organizations to transfer funds to any subsidiary. Go to the next slide. So, so for provider relief funds, there are two categories that the expenses fall under. So the first one is for healthcare related expenses, which includes supplies, equipment, workforce training, costs associated with COVID-19 testing and with results, building or constructing temporary structures, acquiring additional resources, and developing and staffing emergency operation centers. In terms of lost revenue because of COVID-19, decrease in patient visits, elective procedures, and services, if you had increase in payroll for employees and contractors due to the pandemic, having to pay extra benefits for employees, and the increase in uncompensated care was also an eligible lost revenue. In addition to the above, funds can be applied to rent and mortgage payments, equipment needs, and licensing fees. Okay. And in the same way, in order to prepare before the application opens, these are the steps that providers can take. They would need to determine eligibility, All providers eligible for previous PRF distribution, plus new 2020 providers and behavioral health providers can apply. You would need to get to validate a tax ID number and register in the PRF portal and enter the TIN. Compile costs, and this is one of the things that you can do to help prepare so that you're not scrambling when the application comes along. Compiling costs associated with COVID-19. So his documentation about historic revenue and tax documentation, anything related to lost revenue that you can use as support documentation, and any new costs associated with treatment like extra PPE, masks, face shield, gowns, gloves, sanitizers, like all those kind of things. I would compile the cost for those things. Go to the next slide. Thanks. So in terms of the process for both of these programs, if your organization has not previously applied for a grant before, I just wanted to share with all of you that this process is not as complicated as you may think, especially because it's federal funding. The application process is very straightforward. I think that the bulk of the obstacle for the application may just be the narrative. And I think that as providers, especially during this pandemic, it's easy to pinpoint the difficulties that our communities are dealing with, right? In terms of metrics of, how many people need care and how many extra patients there are, or how many patients we've lost, or those kind of metrics. I think that those are the important things for the narrative. Outside of the narrative, the actual portal, the actual application process and things like that are very straightforward. So I encourage all of you to apply. On top of a predictable process with clear eligibility guidelines, straightforward application portals, and also very simple reporting. There's also going to be support from the recovery office, which will come in the form of ongoing question and answer support, and you'll be able to email Kansas COVID support at ks.gov for any additional questions you may have. And there will also be future webinars throughout the grant process, which will include an application process webinar to help you with the application. And we can also talk about compliance, and there will also be a webinar for implementation support, which will include things like, the different kind of training that you can offer your staff to be able to allocate costs to make sure that you're not using funds, to make sure you're using funds appropriately, and different pinpoints that you can have for weekly meetings and things like that. And then in terms of reporting for the FCC, I know that everyone is nervous about the reimbursement process. So we will also be offering some form of support to walk you through the first reimbursement process on the IPP platform. And after you've done it one time, it becomes fairly simple. I think one of the hurdles is if something is not an eligible expense, they'll kick it back to you, and then you'll be able to readjust, or you'll be able to correct whatever the issue was. It's not that complicated. So with that, I think that this would be a good time for me to kick it over to Monica Simpson, who was invited who was gracious enough to come and speak about her experience with both of these programs.
Hi, thank you guys for having me. I appreciate being here. Thank you, Micah and Jen, for the conversations we've had. I'm excited to share our experience with everybody today. So we received both the FCC grant as well as the Provider Relief Fund. I would like to say that our Director of Business Operations was a key part in keeping all of this stuff going as well. So we had a lot of support throughout our agency, and that was really good. with the FCC grant specifically, I kind of echo some of what we've already heard. I think the keys are, it looked kind of scary. It looks really big because it's a federal grant, but the biggest hurdle to accomplish, first of all, is just making sure you have those SAM IDs and that pre-work kind of stuff for the FCC grant. And then really, as I told Jen and Micah previously, it's been a year for all of us. And looking back on a year, if like a year like this, if nothing is glaringly standing out to me as extremely difficult, then it probably wasn't as difficult as maybe it would have felt otherwise. And that doesn't mean there wasn't some challenges along the way, but overall, it was a very positive experience working on the FCC grant. And the Provider Relief Fund grant was equally easy to process and easy to report on. So without the FCC grant, I'm not sure how we would have accomplished as an agency really being able to provide that telehealth to our area, to our county, which is Labette County. And I heard earlier the KDHE speakers discussing, that access to care, and we have a very impoverished county here, and a lot of difficulty with that access to care and being able to travel to appointments outside of COVID time. So being able to continue that process, I think, would be extremely important. And just having that ability to connect our clients to the services they need in the midst of a pandemic was so helpful. And again, I'm not sure without that FCC grant how that would have been accomplished, because we were able to purchase not just the laptops and the PCs and the cameras and microphones and all of those different things that we needed to provide that telehealth. But for instance, our southern part of the county is extremely impoverished. And we had conversations about, well, what if not only can we offer them the telehealth, but how are they going to access that telehealth? Because maybe they don't have access to internet services, or maybe they don't have access to equipment that they can join in a telehealth appointment. So part of the FCC grant was we got iPads so that we could take those to those clients and then be able to access that telehealth technology. So it was an extremely important factor for us as we got through this pandemic year to be able to provide that service to our clients in our county and continue the best possible service possible, even in a difficult time. And as Jen said, the reporting can sound or appear like it might be difficult, but once you get used to it and once you're in it and do it the first time, the reporting was very simple. The biggest frustrations might be if you put something in and they said, no, that's not a covered expense, and so they would deny it, or maybe you didn't list it right or something along those lines, and you just resubmit. And the process was very simple and straightforward, so we didn't really have any issues with getting that reporting done for the FCC grant. The Provider Relief Fund was a very straightforward, easy portal to report information to. So that was also not a huge issue as we went through the process. Am I forgetting anything?
I think that you covered a lot of it. I think a few other points were, so you spoke about how the eligibility took a little bit longer than expected. I think that that's like an important thing to highlight, as everyone's, if you're considering applying for these funds, I think it's important to get those things in order. Another cool thing is that Monica shared that she has applied for a few different grants, and if you have applied for the PPP or for any other grants, as long as you're not using the same funds for the same resource, I think that that's highly encouraged. But yeah, other than that, Monica, thank you so much. I think that you've covered the topics. Oh, another thing I wanted to share is, I know not everyone has the resource of having someone that's specifically dedicated to grants in their organization. If for some reason, and I know that everyone is spread a little thin during this pandemic in terms of resources and things like that. So if for some reason, like, you know, you're not able to write a grant or you're unsure of how to go about this, there are resources out there to help, like grant writers and things like that, that you can bring on to help with just this narrative piece or just with the application. But I just wanted to share that.
So thank you, Jen and Monica, for everything that you shared with all of us today. I'm really excited now to open this time up to questions from the group. The main goal, I'm actually going to stop sharing my screen at this point to make this process easier for everyone. But the main goal of this question and answer time is for you all here in this virtual room to ask Jen and the rest of the team questions about what's top of mind for you, and to potentially learn more about Monica's experience if there are other questions that you have for her about her experience with the first round of the FCC grants, as well as the Provider Relief Fund. So with that, I haven't seen any questions come through within the chat. If anyone would like to raise their hand or type their questions directly into the chat, I can start facilitating a little question and answer right now. Well, as of right now, we've had no questions trickling in. I guess Jen just did such a tremendous job giving you all the information out there and heard so much from Monica. While we wait for some questions to trickle in, I wanted to let you all know that we will be sharing a recording of this webinar, as well as the materials that were shared today, as well as the appendix section that includes a little bit more of a deep dive on the application and some of the other next steps that can be taken to prepare, just to let you all know that that will be available shortly. So Jen, we did just get a question about the due date for either of the applications. That I can answer before I hand it over to Jen. If you want to add, the actual applications have not yet opened for either. We currently, the main reason we're holding this webinar is to get ahead of the process and ensure that providers across the state of Kansas are ready once the applications do open. But we will be sure as a recovery office to continue to communicate with you all as we learn more. Jen, do you want to add to that at all?
No, I think that you covered it. I think that's right. I think the important thing is just to prepare and be ready for when the application launches.
Yes, thank you, Jen. So the next question comes from Matt. He said, to be clear, this is new money that can be applied for, even if we applied and received money under the first round of relief money. Correct. Matt, that is correct. This is an exciting opportunity to apply, even for those such as Monica, who may even want to speak about how she's planning to apply for a second round of both the PRF and the FCC fund. The goal here is to continue to push telehealth and medicine in general forward. And even if you did take advantage of the first round of the programs, you're still highly encouraged to apply again. Monica, do you want to speak briefly about your plans to apply to this program?
Yeah, so I saw the question, how did, with multiple grants that cover some of the same experiences. And I do want to mention that our team worked really hard together on this, including our executive director, Matt Atterbury, our director of financial services, Asha Patel, our director of clinical services, Misty Mustaine. We all kind of really worked as a team to accomplish keeping track of all of those things and really being able to keep all the reporting separate. But it says with multiple grants that cover some of the same expenses, how did, and I hate to speak too much for our financial director, but I know we just did a lot of spreadsheets. We did a lot of tracking of each individual thing and what portion it might have gone under, because some of the different grants may have covered the same type of things. We just had to be careful. We weren't putting the same items on all the different lists and just reporting those individually with the information that went to those particular grants that we had requested.
Thank you for that, Monica. That's all super helpful. Another question came in asking if there's going to be another round of the provider relief fund distribution. Just to make sure we're clear on that, there definitely will be another round. There just hasn't been an announcement of what date that specific round application process will open. However, we do know that a large amount of money has been allocated to the provider relief fund for the same purposes that was in the first round of PRF funding. One other question that came through that, Jen, I'm hoping you'll be able to answer is, I have a question of whether educational institutions beyond traditional medical schools are eligible. For example, community or technical colleges that have healthcare programs for nursing, dental assistants, and so on and so forth. What are your thoughts on that, Jen?
So my thoughts are that if you have any medical instruction that they would be eligible, I will have to check and get back to you, but there is other funding coming up in the very near future for distance learning. And so that's another thing to consider for programs like that, for education related funds. Yeah.
Perfect. Thank you for that, Jen. We have another question from Diane who asks, do you feel that lost income would include the income paid to staff for meetings and planning surrounding the COVID issue?
So I would say that any lost revenue due to overstretching employees or anything like that would fall under that category. They have not pinpointed specific, specific reasons for the lost revenue, but I think it's safe to say that that would be an eligible expense.
Perfect. Thank you for that, Jen. And I just reshared my screen for a moment. We will be circulating those eligible uses later on as well. Are there any other questions? I haven't seen any others come through the chat. You can also raise your hand if you'd like to ask the question directly to Jen and the rest of the group.
I know Monica mentioned something about the reporting, and I know I'm not sure if a lot of you have received Spark funding. One of the things is that I know for Spark funding, from what I've heard, the reporting process was monthly. And I would just like to say for the FCC and for provider relief, it's minimal reporting requirements, meaning other than the IPP platform to report or to submit reimbursements, there wasn't much reporting required. So that's another thing to consider.
So one other question that just came through, Melinda, yes, this presentation will be posted for us to share to the broader group. The presentation will likely end up being shared on the same webpage that the registration and information about this webinar was posted with updated content, but we will make sure that the same listservs that were circulated with information about this webinar are sending those out after the fact as well. And that communication will also include a copy of the deck that we reviewed today, as well as the appendix slides that go a little bit deeper. So we have a question from Becky that says, if you purchase devices for clients, what reporting requirements will there be?
So for the FCC grant, it would be through the reimbursement process, right? So what would happen would be that you would go to the IPP platform with the invoice that you use to buy the device, and you would just process it through the platform and be able to get the money back for that. Of course, when you give a patient a device that's connected, I would highly recommend having a management system attached to that to keep track of it and to be able to help patients stay focused on the actual use for the device.
We're going to jump one more question that just came in from Stacy. Does the lost revenue include government entities like a mental health center?
Yes, it does.
Perfect. Well, we will be here on the line for the next 20 minutes if there are any other questions, but please feel free to raise your hand or type them directly into the chat, just so that we can be here as a resource to help you all out. Well, Jen, excellent job with your presentation. We don't seem to have too many questions. We'd allocated a full half hour just to make sure that we were able to answer all the questions that may come through. But I know that a few of us looks like are dropping just given the lack of questions at this point. But Jen and I and the rest of the broader team will be on for the next 20 minutes. If there are any other follow-up questions that Annie would like to share with us, thank you all again for taking the time to be here with us today. We truly appreciate all the work that you're doing for all the people of the great state of Kansas. And we're just so excited about these two different programs to help continue to push telehealth throughout the state and really make a huge difference in so many different people's lives. We're excited to share this recording as well as the deck itself over the course of the coming day. And please don't hesitate to reach out to us directly if you have any other questions or concerns.